But in the US, we have not had a scientific review of our limits since, actually not in 1996 either, but our limits were set in 1996 and have not been updated since then. So how did this happen? Well, there used to be a very active research program in the United States. Through the 70s and 80s, we had a robust EPA laboratories, staff who were measuring, monitoring, studying this issue, issuing reports on radiofrequency radiation. In fact, the EPA was tasked to develop safety limits, but was defunded. The Telecom Act passed in 1996, and at that time, the FCC adopted RF limits. Legal action was filed by several groups, and you'll probably hear about the Cellular Phone Task Force case against the FCC. And in it, the groups allege that these limits are not acceptable. And there's many people still working on the issue now who are in that case. The court did not have a favorable ruling for the petitioners. The key reason was they said that the FCC could reasonably expect agencies such as the EPA to keep abreast of scientific developments. And they talked about how the EPA had been on the verge of releasing its own draft guidelines. So at that time, the court thought and believed erroneously that the EPA was working on this issue, when in fact, at that time, there was very little activities left in the EPA related to researching the health effects of wireless radiation. This is in my paper in Frontiers on Public Health, because I think it's so important to note. So when the EPA was, just as it was poised to release safety standards, a safety standard means that agencies have looked at the issue, they have developed it based on science, but we never did. This is a briefing that they did to the FCC about it, where they talk about their strategy. Phase 1 is going to be interim exposure guidelines, where they're going to look at known effects. Then they're going to also look at modulation, pulsation, the complexity of the wave, and come up with some final exposure guidelines. This was fully defunded. The EPA never developed safety limits for wireless radiation or for non-ionizing radiation. This is the last review that was published on radiofrequency radiation. It's from 1984, The Biological Effects of Radiofrequency Radiation. And I talk about this in my paper and document it. So if you want to go to the sources, or you can do that in the paper in Frontiers that I published in December. So we have a regulatory gap. There's no review of the totality of evidence by any U.S. federal agency in the near recent times. No risk or hazard assessment, no science-based evaluation of FCC limits. Are they appropriate? Normally, you would take the level at which credible research that you've evaluated has shown harm based on a process, and you would compare it to FCC limits and ask, are these limits acceptable? That has not been done. There is, in fact, a near absence of EMF, non-ionizing radiation activities by all U.S. regulatory agencies with health, safety, or environment expertise. Now, in our case against the FCC, I guess I should take a step back. So in 2019, the FCC said, after 7 years of an open inquiry when information was submitted to the record, they made the decision that they didn't need to change their limits. And both myself, at the time I was executive director of Environmental Health Trust, and other petitioners then took legal action against the FCC with 10,000 plus pages of evidence. And in 2021, the U.S. Court of Appeals for the D.C. Circuit ruled in our case that the FCC's decision not to update its 1996 wireless radiation limits was arbitrary and capricious. And the court found that the FCC had not provided evidence of properly reviewing the record evidence related to non-cancer impacts. That would be like impacts to the brain, reproductive system, immune system, long-term exposure, children's vulnerability, how our compliance test procedures are relevant, and that there had been a complete failure to address environmental effects. The court ordered the FCC to explain how its limits were protective for the issues it had ignored. The FCC has not responded. So people ask, well, what does that mean? It means that our limits are not defensible at this time, that the FCC has not shown that it has properly evaluated all of the research on its record. It has not explained how its limits are adequately protective. And what I would say is, if the limits are so safe, and if the FCC did such a stellar job in looking at this issue, where is its homework? Where is the explanation? Why couldn't they just come out explaining how our limits were protective? Now, in that case, in the decision of the DC Circuit, they note the silence of our expert agencies, saying, because the FCC said, well, no one told us that there was a problem, as if that means that this exposure is safe. And the judges said, the majority said, the silence of other expert agencies, however, does not constitute a reasoned explanation for the Commission's decision to terminate its notice of inquiry for the same reason that the FDA's conclusory statements do not constitute a reasoned explanation. So here we are in 2026, and we're facing the fast tracking of cell towers, and yet we have the 1996 Telecommunications Act that says no state or local governments may regulate wireless facilities on the basis of the environmental effects so long as the facilities comply with FCC regulations. So local officials are often warned that they could be sued if they stop the placement of cell towers due to concerns about health or environmental impacts. I have been stopped from speaking in meetings if I start to talk about health. They say, oh, I can't hear that. Or one woman had a whistle blown at her. How does this make sense?
I heard some people saying that we cannot protect ourselves from 5G on health reasons. Now, I don't know where in the corporate infrastructure somebody was paid to say you're not allowed to protect yourself in the name of health. My God, that's some crazy stuff, isn't it?
This is federal preemption. It comes up over and over again. But how can environmental or health effects, so under environmental effects, health effects is considered an environmental effect. How can it be disallowed in cell tower siting decisions when our government has not done any science-based review for decades? And we have limits that are sky high. This is pretzel logic, as coined by Blake Levitt. I talk about this in my papers in Frontiers. We have a complete, utter lack of oversight related to this issue.
To FCC Commissioner Carr, asking him to cite for me recent scientific studies demonstrating the safety of this technology. What research has been done, where has it been published and compiled. He has essentially failed to do so, and just echoed the general statements of the FDA, which shares regulatory responsibility for cell phones with the FCC. If you go to the FDA website, pretty unsatisfactory. There basically is a cursory and superficial citation to existing scientific data saying, quote, the FDA has urged the cell phone industry to take a number of steps, including support additional research on possible biological effects of radio frequency fields for the type of signal emitted by cell phones. I believe that Americans deserve to know what the health effects are, not to prejudge what scientific studies may show, and they deserve also a commitment to do the research on outstanding questions. So my question for you, particularly Mr. Gillen and Mr. Perry, how much money has the industry committed to supporting additional independent research? I stress independent research. Is that independent research ongoing? Has any been completed? Where can consumers look for it? And we're talking about research on the biological effects of this new technology.
Thank you, Senator. I think, thank you for your focus on the issue. Safety is paramount, and as you alluded to, we rely on the expert agencies, we rely on the findings of the FDA and others as to the requirements to keep all of us safe. There are no industry-backed studies, to my knowledge right now. Happy to visit with you as to what opportunities you think there needs to be more studies, and we're always for more science. We also rely on what the scientists tell us.
So essentially, the answer to my question, how much money? Zero.
I can certainly follow up with you, Senator. To my knowledge, there's no active studies being backed by industry today.
Anybody else know of industry commitments to back research, fund it, support it, to ascertain scientifically the health effect?
Senator, I'm not aware either, but I do know that with small cells especially, you're going to have lower power levels. And of course, as from a carrier perspective, you want to be able to manage interference so that that interference is the lowest interference possible. So I would think that some of those studies or some of that information could be utilized in looking at the health consequences. But no, I'm not aware of any.
So there really is no research ongoing. We're kind of flying blind here so far as health and safety is concerned.
We have no measuring and monitoring program to know, well, what are the levels that I'm experiencing? Someone just asked on a listserv where there's a situation with a cell tower. Well, has anyone gone around and measured? Well, we don't have a measuring and monitoring program. That was defunded. There used to be field offices that the EPA and FCC staff would be measuring. We don't do that anymore. There's no oversight program to ensure cell tower emissions are compliant post-deployment. No required yearly checks or audits for cell towers. I'm talking about at the federal level. No national publicly accessible database of all cell tower and wireless sites. I mean, if you want to know if there is a cell tower near you or proposed near you, it's a whole job. And I know many of you on this call know that. It is a lot of work. It should not be this hard. That information should all be transparently presented by the federal government as well as local governments. And there's really a way to do that because many countries have done that. There's no excuse for the US not to be doing that. There's also no pre-market safety testing before deployment of new technologies, no post-market surveillance of health or environmental impacts, and no medical or health reporting mechanisms. So if a doctor documents an impact, as they do, often they don't have a place to submit that. Like with a drug, you can report side effects. We don't have that for radio frequency wireless radiation. And there's no robust occupational health program. Actually, there's a lot more issues, but that's sort of my cliff notes. Now, many countries have a way that you can go online in a publicly accessible website, see where base stations are, type in an address, and find what's near you, find what the levels are, and so forth. This is showing, and you can actually go in and out. This is a map of Switzerland where you can see base station antennas. This is the French website where you can go in and type your address and see what the measurements are locally near you. Greece has 500 fixed stations and several mobile stations where they go around measuring. All of that information is presented. Now, I do need to tell you that there are many issues with many of the way countries are measuring and monitoring, but at least they are doing something. It is 1,000 times more than the United States, where we don't have any of this. And there are actually publications on issues related to each country's, the way they're doing it, how they might be averaging, which is, of course, they're averaging, really big issue. But here in the United States, when I've done FOIAs, I have not gotten a lot of information. Like in New York City, they won't give me the RF reports. Many people have reported that to us. When a former engineering consultant went on rooftops across the country, there's a Wall Street Journal article where they found 10% of the rooftops that were visited were out of compliance. And this can be not just the RF radiation, but making sure that people aren't able to go in areas that are exceeding FCC limits. So there are a lot of regulatory issues that require compliance. There isn't anyone checking, actually. So this engineering consultant filed 100 congressional complaints with the EMR Policy Institute, and no enforcement actions were taken. Now, when I at EHT requested RF compliance reports from both New York City as well as the FCC, I was denied. And in one case, because Verizon objected. So I just put the letter here where Verizon said they object to the release of the total number of rooftop antenna locations owned by Verizon, and that would be provided in the compliance reports. So it's confidential and needed to be treated as non-public. Just recently here in Montgomery County, I was told by a wireless company, who I'm not going to name right now, that the information was proprietary, confidential, unacceptable in my book. And the Swiss government has a map where you can actually see what the wireless radiation levels are estimated. Again, there are issues with all of these types of platforms and how they measure and such, but at least they have something for the community. And here they have, it's color coded by the levels of measurements. And this is the Swiss Basel government. Whereas our last measurement report was from 1986, the EPA's last measurement report. That's the cover of it. Again, go to my paper, U.S. Policy on Wireless Technologies and Public Health Protection, Regulatory Gaps and Proposed Reforms, published in Frontiers in Public Health, to learn more about the regulatory issues